Okay, folks, welcome back to another wonderful edition of Opali Presents Know Your Pros. And today's guest, we have Dr. Jan Suckut, who is a chiropractor, an ergonomic specialist, and the author of Health at Your Desk. If you want to visit her, you can visit her clinic at Chiropractic Way here in Simi Valley, California. She preaches to set up, get moving, and get healthy. Dr. Jan, it is a pleasure to have you as a guest today.
Glad to be on.
Dr. Jan, I don't talk, truth be told, to quite a lot of chiropractors, but I think that I should be, just because I spend a lot of time at my desk here. I'm a digital guy. I kind of say to other folks who might be working a little bit more with their hands that I'm a soft-handed keyboard jockey, right? And a lot of my day takes place right here at my desk. I know you've got a chiropractic clinic where you do lots of different modalities and methodologies with correcting your patients. But you decided to write this book at Health at Your Desk. Can you tell me why it was that you decided to become an author and evangelize about being more healthy in a desk setting?
Yeah, treating clients, you really have to get at the root cause of what's causing their problem, because if you don't, it's a never-ending cycle of pain. They don't get better. They get frustrated. I get frustrated. It just you really need to get at what the root cause, and it could be anything from looking at the bottom of their feet in their shoes. Are they wearing their shoes funny? Did they hurt their ankle? Are they limping, which is affecting their back? Are they carrying a heavy purse or a bag? And the biggest one is really computer use. Our technology is getting smaller and smaller. And as we get smaller and smaller technology, it's better in a sense of being more portable, but we become more unergonomic. CPUs are more ergonomic than laptops, and laptops are more ergonomic than tablets. And we go down to the phone. Kids and adults are spending hours on their phone, and it's not good for the neck posture to be in that position for long periods of time. So what I found was a lot of people were complaining of upper body pain, sometimes low back pain, mainly neck and upper back. And when I talk to them, just little questions like, how high is your keyboard? Where are you positioned at your desk? We talk a little bit, but I really would give them some advice, but I think they didn't have something to reference, so they didn't go home and do it. So it wasn't going anywhere. I tried to bring in that ergonomic aspect of how to set up their desk, but they had nothing to take home. So it was the same cycle. So what I decided to do was write a book called Health at Your Desk. And the reason I wrote it or named it that specifically was originally it was an ergonomic book. So step-by-step process. I have desk health guides that I give with the book that you can sit at your desk, and there's a 6-step process. How high is your monitor? Where's your monitor compared to your keyboard? Where is it compared to your chair, and the right measurements and where you should be. And it sounds complicated, and it can be a little complicated. And that's why I can consult and come in and fine tune what you've already done. Because usually you don't get it 100% correct. And there's little tiny things that you don't realize. So when I come in and set that up properly, usually we're good to go. And then the pains get rectified when I treat. So it's a win-win situation. But when I was writing the book, all these studies were coming down how unhealthy it was just sitting at your desk. Sitting at your desk for more than 30 minutes increases your blood pressure, increases your blood sugars. 30 minutes. And that's not healthy. So we need to get up and get moving. And so then I put in a whole slew of exercises in the book, and it kind of wrapped up the book that way, showing that, yeah, we can be injury-free at our desk, but that doesn't matter if we're unhealthy and we're dying at our desks. They were saying that sitting was the next smoking in some of these studies. So you can sit at your desk all day. You can smoke a pack of cigarettes a day. I mean, one's more fun than the other. No, I'm kidding you.
It is a funny thing to bring up like, there is more of an ergonomic factor to having a desktop versus a laptop that you're hunched over to what you're craning your neck to look at on your phone, right? And it's all leading to this just degradation of our spine and our health and the cartilage that holds up this big you know uh, mass of a human being, which is our body, right? And it's important to think about. I want to understand a little bit of, like, with all what you just said kept in mind, why, like, was it that you became, I suppose, like a chiropractor in the first place? And why so excited about the ergonomic specialty here? I mean, was it some experience that you had? Tell me, like, a little bit about what kind of led you to this position that you are in here today.
So, well, I became a chiropractor at 23, super young. And when I was going to school, I was actually going to school to become a physical therapist. And we needed so many volunteer hours. And of course, volunteers get the best jobs at the hospitals, as you know. Lugging around 40-pound whirlpools and severely herniated a disc in my back. So here I am at 18 in severe back pain, severe leg pain, totally freaked out because I've got my life in front of me. I need to go to school. It got so bad I was getting heart and chest pains from it. I mean, extreme anxiety. But when I was getting treated, I went allopathically. So I went to a orthopedist because of how I always grew up. I was never exposed to chiropractic when I was younger. And the evaluation was very painful, went to physical therapy, and I actually got worse. Now, sometimes you get worse before you get better. I can't blame that end because there are places for that particular thing, but that's how I perceived it. And my mother-in-law at the time had a chiropractor that she recommended to me, and within 5 treatments, I was pain-free. So my eyes opened and said, I think I don't want to wait to go to physical therapy school. I'm going to dive, and I'm going to dive right in and go to chiropractic school instead. It helped me, so I knew it helped. So that's a lot of times what we do. We get helped by something, we like it, and so we try to do that for others, basically.
Why then is it that somebody should come and visit you, Jan? Whether it's visiting you at your clinic, or why maybe should somebody choose to pick up your book? What do you see as the vast importance of that book, and why should somebody visit you as a chiropractor over maybe anybody else, or take advice from you over anybody else? I mean, I know it's been a while now. You've been in this business for 30 years, but can you give me that answer a little bit?
I think over the years, that's why they call it practicing. A lot of practice. It's kind of scary, right? But just things develop, and you notice that if you don't do more for your clients, as far as one, I'm really systematic how I treat. I do modalities in my office, but I do chiropractic also. So physical therapy modalities with my physical therapy background, but then chiropractic also. But I don't throw everything at once into a client, meaning I wouldn't do several modalities and chiropractic on a one visit, because if I do that, I don't know what works. So I'm very systematic. Let's try this for a few treatments, see what happens. Oh, this is doing good. Then don't reinvent the wheel. Keep doing what's working, right? But the other thing, the added bonus, I think, is just finding the root cause of the problem. Again, because it's frustrating for me being this long of a chiropractor not to get somebody well, because I'm used to getting them well very rapidly. And it's usually because I'm not paying attention. And I find myself sometimes not catching what the root cause is, or not asking enough questions. And I think I try to listen more, and I try to listen to what maybe they've been to another chiropractor in another state and they've moved. What worked for them? I'm not going to reinvent the wheel, and I'm not going to do something to push them into something that I think is going to help them. I'm going to listen to what worked for them. So I'm a big listener, and I've learned that over the years, that if you just don't force people into something they don't want to do, or it doesn't work for them, it works way better. They're way more relaxed. I've got a very spa-like atmosphere in my office. That's another thing that I found, that if people relax, they're going to adjust so much easier, and you just don't have to fight it, fight the muscles.
Right, right. It's very important, of course. You got to be loose to get worked up. And I think that's great to point out here. So Dr. Jan, you know, we're short on time here. I love what we've covered already, but I want you to tell our viewers, maybe anybody out there who might be curious now watching this video, where they can find your practice, and more importantly, where they can find your book at Health at Your Desk.
Okay, so my website is drjanchiropractor.com. So it's DRJAN, chiropractor.com, all one word. And you can go on there. There's a space that says author on there. You can go and click on that. That's my book, but you can also go to healthatyourdesk.com. That'll lead you straight to my book. And if you want to, you can purchase it off there if you want. You do get a $5 discount if you contact me. There's an email contact page. It's under contact on my header of my page. Email me, we'll hook up, and I'll give you a $5 off on the book. You can come in and see the practice, and we'll exchange a tour of the book in or my practice. But yeah, I'm happy to do that.
Beautiful. Perfect. Well, yeah, folks. And of course, as always, everything that Dr. Jan just mentioned is going to be in the description of this video below. So click those links, visit those websites that Dr. Jan just mentioned. And if you find yourself in Simi Valley, on the days that she is up and in her office, go on by and visit her. Come and check it out. It's very soothing and calming. And the book is changing the way that I'm currently sitting at my desk right about now. I'll tell you what. So Dr. Jan, that's about all the time that we've got here today, but I want to thank you so kindly for deciding to come on our show here at Know Your Pros. Thanks again.
Thank you. Bye.
Know Your Pros.